Dr. Swati Srivastava, Senior Professor and Unit Head, SMS Medical College, Jaipur, and Consultant in Charge, Thyroid Clinic, SMS Medical College, Jaipur. Today in this APICON 2022, my talk was on metabolic syndrome and PCOS. Now, PCOS is polycystic ovarian syndrome, is basically a heterogeneous group of disorder which is constituting of either menstrual irregularities, hyperandrogenism in the form of hirsutism or acne, and terminal hair, and polycystic ovaries. Now, it is commonly misunderstood that this PCOS only is a disorder for reproductive age group women and mainly concerns fertility, menstrual issues, and hyperandrogenic issues. However, we need to remember that it has a very significant metabolic syndrome overlap to it. Basically, insulin resistance is the one important feature which occurs in PCOS and which is a very important feature of metabolic syndrome also. So what happens is when these young women with PCOS, they are followed up, it is found that they have around 2 to 4-fold higher chances of developing type 2 diabetes in later life. They may also develop hypertension, lipid abnormalities, and obesity. Now, central obesity in girls, what happens is usually what we feel is that when these women have type 2 diabetes, we advise them for lifestyle modification. But we should remember that this all has started right when the girl was in a second or the third decade. So when we see girls in second and third decade, if they have central obesity, they have a very high chance of developing PCOS, and these are the girls who will later on going to develop metabolic syndrome and type 2 diabetes. So we should remember that our focus on lifestyle management in the early age group of the girl is very important. We may prevent gestational diabetes that she may have later on. We may prevent type 2 diabetes that she may have later on, and we may prevent so many other lipid abnormalities and cardiovascular issues and cardiovascular problems that she may have later on. So our focus should be on the lifestyle modification which the girl has right since her younger age group, and have corrective measures for polycystic ovarian syndrome, so that at a later stage the metabolic syndrome is also prevented. That becomes very important. That is my message for the day. Thank you.